Currently, I want to let us know that Soroti Regional Referral Hospital COVID-19 Treatment Center has the highest number of COVID patients in the whole country. And because of that, we've had teams coming here. Just this week, we had a team from World Health Organization. We've had a team from the ministry. We had a team from Baylor. And just tomorrow, we have other teams coming to see how come Teso still has very high number of patients. Just our neighbor, Lira right now has only 6 patients admitted in the hospital. While for us here, we have up to 68 patients. So we have so many patients. Mulago has about 40 patients admitted. And ideally, Mulago should have the highest number. But so we still have quite a number of patients. And all these patients actually come from the region of Teso. Surprisingly, these are very old patients. Most of them are more than the age of 65. All of them are not vaccinated for COVID-19. We have also known that most of them actually are brought to hospital very late. And almost everyone that has died in our center here over the last 2 months is an old man or an old woman, more than the age of 80. And they come in late. Most of them die within the first 1 day. Others die after about a week or so. But majority of them die within a week. And they really come very late. As a COVID-19 treatment center and as a region in a whole, we asked ourselves why. And we came with 2 things. One is that majority of our old men and women are brought in late because their families still believe that they'll get better. When things get really out of hand, that's when they're brought to hospital. We've also learned that oftentimes the family members do not really help them to take them to acquire the vaccines. Right now, very many people want the vaccine, and you have to line. Just on Monday, people come here at 9 a.m. and some of them end up leaving at 6 waiting for the COVID-19 vaccine. So most of them have not actually helped their relatives to bring them to acquire the vaccine. As a hospital, we feed our patients, we give them at least lunch, but breakfast and supper, the family members support the family. So the support that Demo Rikikinos has brought today really helps our patients to make sure that they keep fighting the COVID pandemic. We know that food is a very important component of treatment. Without food, even if you give the best care, somebody may not actually get fine. So what the team has brought has come at the right time to support our people. I want to again re-emphasize that the team brought food items about a month ago, and we are lucky that today again they have come with support for the patients here to acquire. I've seen pineapples, I've seen soap, I've seen sugar, bread, and I've seen also Irish, and this is going to really help our patients to recover from COVID-19.
Just a brief about the vaccination process at the center.
So I want to let us know that from Monday we began vaccinating our people again for COVID, and this vaccine is available in all the districts of Teso. So wherever you are, you don't necessarily need to come to the hospital here. You can actually get your vaccine. In Soroti here, you can get your vaccine from Soroti Hospital, from Princess Diana Health Center 4, Tiriri Health Center 4, Gweri Health Center 3. You can actually get your vaccines there. We have got for Soroti over 2,000 doses. Right now we are prioritizing teachers, health workers, and then those who are more than the age of 50, and especially those who are supposed to get their second doses. We hope that in the next few weeks we should be getting vaccines for even the younger ones, those who are between 12 and 18, and also making sure that students will eventually be vaccinated for COVID.
So how best do you think government facilities like this one can be best supported to handle critical cases and anticipate the third wave?
So we, as a hospital, as a region, we are already anticipating the third wave. But we are preparing ourselves for the third wave. In fact, personally, I believe that if we can prepare sufficiently, there is even no need for another lockdown, even if the numbers become many. Why we lock down is because we're trying to build capacity. People have become too many. Let's first pause a bit. But if we prepare sufficiently, we should be able to avoid another lockdown. But what are we doing? We are auditing, especially we have done audits of all the people that we have lost and asked ourselves why they died. Is there something we could have done differently? And I can tell you one of the things that comes up is the issue of oxygen. So yesterday we had a meeting with the Director General in charge of creative services, and we agreed that the ministry gives us a truck, a standby truck here, so that it goes to Kampala every 2 weeks, twice every week, to be able to pick oxygen. Because oxygen is a very essential drug for our patients. So as at the level of the ministry, for treatment centers, you need a lot of human resources, people are going to work, PPE to be able to be available, drugs, and especially oxygen. For Soroti, we have been promised a new oxygen plant by UNICEF, and yesterday we were told sometime next month we should be having a new oxygen plant in Soroti. And if we get that one, plus our existing plant, we should be able to help our patients better if the third wave hits us as a country.
Now, Doctor, from the period of July to date, how many death cases have you recorded?
So if you look at death in terms of, usually I talk about death looking at the first wave and the second wave. The first wave we lost about 15 patients. The second wave we have actually lost a very big number of patients. We have lost over 70 patients just in the second wave alone. So the second wave has been very deadly compared to the first one. And if the third wave comes, it will even be worse than the second wave. So we really have to be prepared sufficiently. As I talk about death, what is very painful for me is that a number of my colleagues, doctors who are treating COVID patients, have actually died. Interestingly, some of the ones who are in charge of treatment centers in different regions have died. The one in charge of treatment of COVID in Barara died. The ones in Mulago died. So colleagues have actually died. We have lost over 50 doctors to COVID-19 in the second wave alone. So it has been very painful for the medical fraternity, but importantly for families. Many of us have lost our loved ones to this pandemic of COVID-19. We have done our best under the circumstances to try to save life, but it's very painful that many families have lost their loved ones to COVID-19.
Now talking about oxygen, how many oxygen cylinders now do we have?
So oxygen, I can tell you, oxygen has been a problem. A very big problem in not just in our treatment center here, but also in the other treatment centers. Oxygen has been a very big problem. In terms of one, the oxygen itself, 2 cylinders, 3 oxygen regulators. But I want to report, just about 2 or 3 months ago, whenever our trucks would go to Kampala, we'd only go and pick 40 cylinders of oxygen because we didn't have enough cylinders. But I want to report that we have now up to 160 cylinders. 2 months ago, we only had up to 60, but now we have at least over 160 cylinders. On Friday this week, we got Absa Bank donated for us 40 new oxygen cylinders. So the oxygen cylinder situation has improved. The oxygen regulator situation has also improved. What hasn't improved yet sufficiently is the amount of oxygen, because the plant has remained only one. We believe that if we get another oxygen plant, then the actual gas itself will also get better. But for now, we keep sending trucks to Kampala. As you can see, we have cylinders there that we are putting together. Either tonight or very early tomorrow, I am sending another truck to Kampala to pick oxygen. But what I am urging the ministry is to just give us a truck that is going to park here, so that it goes to Kampala. When it comes back, it remains parked here. Only for oxygen for Soroti. And I've argued, because Soroti has the highest number in the country now, priority must be given to us. The ministry secured over 40 trucks. They're all in Kampala. I am urging Ministry of Health to just give us one standby truck to be available here. Why am I saying this? Because availability of trucks for us has been a problem. Hope Chest donated for us a truck. Sometimes we get a truck from the district. Sometimes you find that the person who with the truck is spoiled that day. It's not available that day. So we really want to have a standby truck that is going to be taking for us oxygen cylinders for Kampala for filling on a regular basis. And I'm happy that the Director of Health Services in charge of Community Services here yesterday said he's taking it up, and I'm hoping that sometime this week they should be able to send us a standby truck